Hello and welcome to the daily coronavirus update live from Fox. I'm Claudine Wong, and we are going to be streaming for you every day on coronavirusnow.com. We start at 1 p.m. Eastern and 10 a.m. Pacific, and we bring you really all the latest information about the coronavirus outbreak nationwide. We always like to start with the big numbers because Fox has been tracking these numbers. Here's the latest. Keep in mind, these numbers are always changing, so we try to give you the very latest when we have them. All right, take a look at your map and you can see the states that are marked in orange. Those have the biggest numbers. There are now more than 35,000 cases across the country. 471 people have died from the virus in the U.S. We know New York has been hardest hit with the most coronavirus cases in the U.S. by far, with more than 16,000 confirmed cases, and 7 states that you can see them highlighted on this map have more than 1,000 cases. All right, let's take a look at the markets as well for you, because certainly it's been a tough road here as investors wait to see if some kind of deal can be made on this coronavirus stimulus package. We know the first vote did not go through, but we are hearing from lawmakers on Capitol Hill that they are trying to work out their differences. Certainly the market responded to the vote not passing. We will wait and see how the market responds today as we continue to watch things on Capitol Hill for you. All right, we now want to go to New Jersey, and Bill Spadea, the anchor with Chasing News, he's joining us from Princeton, New Jersey, not far from New York City. Good morning, good afternoon to you. And how are things going?
Claudine?
Oh, we're hanging in there.
I'll tell you what a morning. You know, we hear a lot of the news reports about our testing centers that have opened, and part of the challenge, of course, in anything like this is consistent communication. So the newest center opened up at our PNC Arts Center. It's a huge area in central New Jersey. They opened it up at 8 o'clock, and by 8:30 it was closed. And part of the problem is just the mad rush of people going. And you know, my contacts in law enforcement and the medical community say part of the issue is people showing up at the testing center without symptoms. They're just scared, they're nervous, they don't know. And you know, what I've been telling people all along, and you know, I have the advantage of being on the radio in the morning. I do a morning drive show, so I take calls and I'm hearing from people, and I'm just saying, look, you've got to go to your medical professional. If you don't have symptoms, just stay home. You're going to be okay. And that's part of, I think, the challenge that we have with this is all the different information coming out from so many different sources. I had a guy call me this morning in line who was short of breath and said, "What do I do?" I said, "You hang up from me and you call 911. You definitely don't call a radio station."
But I think, you know, at this point, people were waiting so long for the testing centers that they figure, you know, it's kind of like the panic buying, I think. They figure if I get in line, maybe they will give me a test if I tell them I have something. And that really clogs up the system. And I know we've had, as these testing centers open up, there's just not enough of them. And so, and I would argue that some people, I mean, shortness of breath could be just out of sheer anxiety that people are feeling, and they can't diagnose this, which makes it even more important to check with your family doctor first, right?
Right. Well, you know, Claudine, I mean, social media has made us all experts. So I can't tell you how many new doctors and nurses there are right now, right? Everyone is going to Dr. Google and they think they know. And unfortunately, they don't. And I think you look at the contrast where you had what happened in Korea, where the medical professionals are now saying, look, you've had a flattening of the curve, you've had a quelling of this, and they didn't have the same level of lockdown. So part of the anxiety is also from the lockdown that we hear so many people, especially restaurants and small businesses, this whole gig economy that you hear about has been effectively shut down completely. So people are as anxious, if not more anxious, not about the medical and the potential health problem. They're worried about their job. They're worried about where that next paycheck is coming from and what this looks like on the other side.
Right. And so, you know, in terms of the lockdown, too, there are other places that went into lockdown before the area you're in went into lockdown. And I wonder if there are lessons learned from that. Did people watch how it was going down in California and then they were more easily able to, you know, kind of drop into that? Or has it been kind of crazy? You know, I know the governor was telling the mayor you know, you got 24 hours, get this in place, but it's hard. No one wants to come down hard enforcement. Everyone wants everyone to kind of just ease into it.
Not only that, Claudine, but we've had restaurant owners that got a call from the health departments and the local police with a 6-hour window to shut their doors and convert to a takeout only. How do you tell 50 workers, sorry, we're not sure how this is going to work. We're going to have to send you home for now. So thousands and thousands of layoffs and people very unsure. And part of it is mixed messages from the different political leaders. So in New York, you've got it's almost a raging battle between Governor Cuomo and Mayor Bill de Blasio. De Blasio saying over the last week, we're going to have to shut New York City down. Cuomo saying, no, we can't shut New York City down. So there's that conflict that seems to be these political leaders positioning themselves and not thinking about, well, what does this mean for the average person? I'll give you an example. In New Jersey, the top health person, the top health commissioner in the state said over the weekend that she's 71 years old. She says, I fully expect to get it. And as in most cases, I'm expecting it to be mild, but let's face it, we're all going to get it. Now, when you hear that from the top health official in a state, then you say, well, then why are we rushing out to test? Why is everything shut down if you're telling us everyone's going to get this anyway? So mixed messages based on a lot of misinformation and too much political posturing and definitely too much social media.
Yeah, it is. Social media has been a tough thing as well when people come into it, because I think a lot of people are questioning that. I think, and we see all these images coming from across the country. We saw the spring breakers in Florida. You know, we see people at beaches and different places where they're told, oh, wait, I thought I could go out and take a walk. You just can't do it with 7,000 people who had the same idea. What does it look like in that region up the East Coast? I mean, in New York, I've seen pictures of empty streets.
I can tell you in New York and in New Jersey, there is a quiet calm. Most people have heeded the warnings. They've stayed home. The streets are not congested. The positive side of that is first responders can do their job and get to where they're going. The negative side is we have, again, these conflicting messages, right? So many places closed as non-essential, but they keep the liquor stores open. Now, you might say, okay, that's good because, hey, what am I going to do? I'm hanging out at home. But I think there are these unintended consequences long-term that people in New York and New Jersey really need to think about, and they are already thinking about it in terms of domestic violence, drug abuse, alcohol abuse, not to mention the financial strain on an economy that was just starting to swing back and get strong. We had all this momentum. Now you've got millions of people not sure where their next paycheck is coming from. So this is the quiet before the economic storm for sure. But I can report to you that people are taking a pause and they're saying, okay, let's see what's next. And part of that is there hasn't been a lot of direction from anywhere in terms of political leadership saying this is the next step. I referenced South Korea. They had massive testing and had the highest rate of testing in the entire world, and they controlled it because they had a plan to isolate and treat with the test. The challenge in New York and New Jersey is we've got all these long lines for testing, but no plan on what to do with people if they're sick. And that's part of the challenge. I mean, we had some good news coming out of the White House last week as far as these malaria drugs. I think that we've got some positive news on the medical front, but again, what's the plan if you test positive? Because they're telling most people, just go home.
And we should say, too, that people heard that, and then you had medical professionals saying, no, you can't have that. Don't take that. You can overdose on it. And you had the manufacturer of the malaria medicine saying, we're not just going to give it to everyone. We're in testing for COVID-19. So you're right. It is confusing, and as it does change and changes across the country in various cities across the country, certainly that raises a level of anxiety. We hope, though, that it settles down into a space where we can move forward and move forward together, because if we don't do that, there is that sense that things aren't going to get better.
And most of this is going to be the anxiety on economics. We can't highlight this enough that at this stage where there's anxiety over a medical situation, which is largely unknown to a lot of people, they're still figuring this out. The one thing that we do know is that across the world, they're starting to get back to work. So I think when we look at that and say, the reason this thing didn't pass in Washington, one of the reasons is that it's $2 trillion. And I think they're looking at that saying, we're really blowing things up here. What do we do? And I'd like to hear the stakeholders get back to the table and say, how do we get America back to work? How do we get New York, New Jersey, California, et cetera, back to work? And at the same time, take a model from overseas, especially Korea, and say, if you're going to get this massive testing, let's have a plan in place to what we do in terms of isolating areas. I mean, Governor Cuomo did this just a couple of weeks ago, isolating the area of New Rochelle, where there was a high breakout, a high number of people testing positive. That was smart decision making, but somewhere we lost the thread from there. So we're going to need to get this back. And I think long lines at testing centers without a plan on what to do if people test positive, not helpful for anybody, especially our first responders and the nurses and the cops who are out there on the front line and the docs. You know, they deserve our thoughts, our prayers, and our praise, because they are the front line of this, and they're dealing with all the political indecision and picking up the slack to help people take that next step.
And all the frustrations and everything else. So certainly a shout out to all the first responders across the country and everyone down from the first responders to the grocery clerks that are still showing up every day to make sure that what
Walmart,
we can keep going. Can keep going. All right. Bill Spadea, thanks so much for your insight and that perspective. We certainly appreciate it as we move forward in this new reality.
Thanks.
All right.
Take care.
If you are just joining us now, this is our Coronavirus Now update. It is a daily update that starts at 10 a.m. Pacific, 1